Healthcare in the United States is a vast and complex system, often described as a patchwork of public and private programs, leaving many to navigate a challenging landscape to secure necessary medical services. Understanding this system is crucial for every resident, as it directly impacts personal well-being and financial stability. Unlike many other developed nations that have single-payer or universal healthcare systems, the U.S. model is predominantly supplemented by government-funded programs for specific populations like the elderly, disabled, and low-income individuals. This creates a multi-layered structure where access, cost, and quality of care can vary dramatically depending on one's employment status, income level, age, and even geographic location. The ongoing debate surrounding healthcare reform reflects the nation's struggle to balance costs, expand access, and improve the quality of care for all its citizens. At the core of the American healthcare system is private insurance, which covers the majority of the population. Most non-elderly Americans receive their health insurance through their employer or the employer of a family member. These are known as group plans, where the employer typically pays a significant portion of the monthly premium, and the employee pays the remainder. This model has been the bedrock of U.S. healthcare for decades, but it has inherent vulnerabilities. Job loss often means loss of health insurance, leaving individuals and families in a precarious position. Furthermore, the rising cost of premiums, and copays has placed an increasing financial burden on both employers and employees. Small businesses, in particular, often struggle to afford comprehensive plans for their workers, leading to a disparity in the quality of benefits offered compared to larger corporations. This employment-based system creates a direct link between one's professional life and their access to essential medical services, a connection that can be severed during economic downturns or career transitions. For those who do not have access to employer-sponsored insurance, the individual market offers another avenue. The Affordable Care Act, ACA, passed in 2010, significantly reshaped this market by creating health insurance marketplaces where individuals can compare and purchase plans. The ACA also introduced subsidies to help make these plans more affordable for people with low to moderate incomes, and established essential health benefits that all qualifying plans must cover, such as emergency services, maternity care, and mental health services. A key provision of the ACHA was the protection for individuals with pre-existing conditions, preventing insurance companies from denying coverage or charging higher premiums based on a person's medical history. While the ACA expanded coverage to millions of previously uninsured Americans, the individual market can still be expensive, and the choice of plans and providers may be limited depending on the state, creating ongoing challenges for self-employed individuals, gig workers, and those who do not qualify for substantial subsidies. Beyond the private sector, the U.S. government plays a substantial role in providing health care coverage through several key programs. Medicare is the federal health insurance program primarily for people aged 65 or older, as well as for some younger people with disabilities and individuals with end-stage renal disease. It is divided into several parts. Part A covers hospital stays, Part B covers doctor visits and outpatient services. Part C, Medicare Advantage, allows private companies to offer Medicare benefits. And Part D helps cover the cost of prescription drugs. While Medicare provides a critical safety net for seniors, it does not cover all medical expenses. Many beneficiaries purchase supplemental insurance, known as or enroll in a Medicare Advantage plan to help manage out-of-pocket costs like deductibles and adding another layer of complexity to navigating their healthcare needs. For low-income individuals and families, Medicaid provides essential health coverage. This is a joint federal and state program, meaning that while the federal government sets baseline requirements, each state administers its own Medicaid program. This results in significant variation in eligibility criteria, benefits, and services from one state to another. The ACAA allowed states to expand Medicaid eligibility to cover nearly all low-income adults, an option that many, but not all, states have adopted. In states that have not expanded Medicaid, a coverage gap exists for adults who earn too much to qualify for traditional Medicaid but not enough to receive subsidies for marketplace insurance. Medicaid is a lifeline for millions, including children, pregnant women, and adults with disabilities, providing access to a wide range of medical services that they would otherwise be unable to afford. However, the program faces challenges, including provider reimbursement rates that are often lower than private insurance, which can sometimes limit the number of doctors willing to accept Medicaid patients. The cost of healthcare in the United States is a defining feature of the system and a source of constant concern for individuals, businesses, and the government. The U.S. spends significantly more per capita on healthcare than any other developed nation, yet its health outcomes often lag behind. Several factors contribute to these high costs, including the high prices of medical services and prescription drugs, the administrative complexity of the multi-payer system, and the use of advanced, expensive medical technology. The fee-for-service model, where providers are paid for each test and procedure they perform, can incentivize a higher volume of services rather than better health outcomes. The lack of transparent pricing makes it difficult for consumers to shop for care, and surprise medical bills for out-of-network services can lead to devastating financial consequences. This high-cost environment not only burdens family budgets, but also strains federal and state budgets, driving the national debt and limiting public investment in other critical areas. The financial pressure of the healthcare system is a pervasive issue, shaping personal decisions and national policy debates alike.